Good afternoon to everyone and welcome to today's session. Little regrets that about some 10 questions, 17 questions, images are missing. Actually the previous NIMS 2011 and 12 questions have been included to make more and more realistic. So let's take the exam for 180 questions then, right? So around 100 questions were taken from the SWIMS paper, the recent SWIMS paper. So today our comrades are taking their NIMSET exam. You didn't take NIMSET exam, doctor? Huh? So I think NIMSET paper they will give it out. If they give it out, tomorrow evening we will have a discussion, and it is worthwhile discussing the most recent papers. So let's make the great beginning, inviting our Kurnool, Vijayawada, Tirupati, Warangal, Kakinada, everybody. So those who take the exam tomorrow, we will try to give those images in a separate sheet. So the idea is last moment may, it's always better we revise actual entrance exam papers. That's the idea with which we have included previous NIMSET papers, but it went oversight, around 17 questions missing images. Alright, so glossopharyngeal, it is the style of pharyngeus which is typically supplies. Third pharyngeal arch, that's right. Parkinson's disease, 4 to 6 per second. Please give a mic, Asha, and to our friends. Now 4 to 6. Lateral angle of the uterus. What is your honest answer, doctor? Superficial inguinal nodes. Can the online students can punch whether the voice is loud and clear without any stuttering? Please punch whether the voice is loud and clear. Yeah. We welcome our other students, Arundhati, everybody. So lateral angle of the uterus, it drains superficial inguinal nodes, basically superficial inguinal nodes. Actually this was the flow chart. Where is the substrate level phosphorylation, where 1,3-diphosphoglycerate converts into 3-phosphoglycerate is the step at which you have the substrate level phosphorylation. So the metabolic effects of insulin. There is also a very recent question on insulin in the recent paper, Abjuda paper. Hormone sensitive lipase. Who activates it? Glucagon and epinephrine. Who inactivates it? Insulin inactivates it. It was a wonderful paper of the Abjuda, recent paper. We already discussed and thrown the discussion on YouTube, on youtube.com/onlinembbs. You can review that. So doctor, lithium, one question, without that there is no paper. I am sure our classmates may be taking NIMSET paper. Today also there might have been a lithium question. Tomorrow when we discuss we will be knowing that. So lithium carbonate, what is it except it does not lead to?
It will lead to neutrophilia.
Neutrophilia, it causes neutrophilia. That is the reason in those who are having neutropenia, sometimes therapeutically you can use lithium in order to stimulate the neutrophil production is what need to be remembered. Now restrictive obstructive lung disease.
Functional residual capacity.
So functional residual capacity is the one, because there is an increase in residual volume. Hyperinflated lungs is a feature of obstructive lung disease. So that is the reason you have functional residual capacity increased, all the remaining things basically will diminish. McNaughton's rule is criminal responsibility of an insane person if he runs naked on the streets. If he can prove himself that he is insane, law excuses. Connexin is an important component of
Gap junctions.
basically gap junctions they have connexons, a very important protein component. 5-year-old male child with history of fever convulsions. How do you say that is meningitis? Basically, it is the
Brudzinski sign.
Brudzinski-Koenig sign. They are the ones which are suggestive of the presence of meningitis. Now, osteochondritis. What is your answer?
Knee.
Classically, it is the knee joint where the loose bodies are present. Unmyelinated C fibers are responsible for temperature. Unmyelinated C. Large fibered myelinated fibers are vibration, touch. That's the reason whenever there is a demyelination, vitamin B12 deficiency, what get affected? Dorsal columns get affected, because they are the ones which carry vibration, and touch is what need to be remembered. So you must know A alpha, A beta, A delta, and C. Common question in the tomorrow's exam. Now, you cannot palpate iliopectineal line, you cannot. You can palpate vagina, cervix, ischial spines, ovarian cyst, bladder, urethra, perineal body, loops of intestine in the pouch of the Douglas, ureters, urogenital diaphragm, all of them can be palpated on a per vaginal examination. Now doctor, leading and lagging strands, what is your answer? Honest answer.
C.
You also thought C? No. DNA polymerase 3 will help in both leading and lagging strand, दोनों के लिए चाहिए. But not common, no? Do you need RNA primer for a leading strand? RNA primer is basically used for the lagging strand initially. Basically you have a lagging strand. On the lagging strand, a primase reads the template DNA and initiates the synthesis of a small RNA primer, but that is not a feature of the leading strand. So whereas DNA polymerase 3, in fact both eukaryotes, eukaryotes may you don't have they don't use DNA polymerase 3, but it is the prokaryotes which you use. Pol delta, pol epsilon, they are the ones responsible for the extension of the primed segments. So there is a fundamental difference. What is the last long bone? What is your answer?
Head of humerus.
Head of humerus.
18 years.
If it is a overall which bone? It is the clavicle. Basically it is the last of all epiphyses in the body to unite with the shaft of its bone, clavicle. But if I say long bone, that becomes the head of the humerus. Niacin? Tryptophan. A very standard question. Actually all these life cycle stages had been given in the original exam of NIMSED, previous exam. So doctor, pigs and humans, they both get infected when gravid proglotid consumption is there. So that is the point of interest. So in a short future, when the state MD entrances are also one after the other, they are becoming online exams. So once they become online exams, image based questions become a easy thing for organizing for the examiner. Rate controlling step in the biosynthesis of cholesterol.
HMG-CoA reductase B.
HMG-CoA. So that's a important step.
Relative risk.
So you must know what is difference. Risk difference, risk ratio. Attributable risk is the risk difference. Relative risk is risk ratio. Okay. So Fish oils are rich in omega 3 fatty acids. Anion gap 10 is normal or increased?
Normal.
That you need to know.
Up to 16 it is normal.
Very good. Up to
16.
16. Very good. So renal tubular acidosis and diarrhea are the examples of normal anion gap metabolic acidosis is what need to be remembered. Clostridium difficile, intestinal toxicity. Then breast carcinomas, what is except? Obviously HER2 new expression is as with poor prognosis. What is the drug against HER2 new receptor, doctor? Trastuzumab. Trastuzumab. Now RMP of a nerve survey equal to? You did not think sodium, no? Huh? Potassium. Now you became experts. What happened? This is battery is not there. You get the another mic. Is it working? Put battery and give them. Potassium. That's good. Ring K crystalloids.
Leydig cell.
Huh? Typically are seen in the Leydig cell tumors. So what is the modern style? As the newborn baby is born, what are you doing? Stem cell preservation. So that in future cancer aayto dekh lenge. So they have a less graft versus host disease if you use them in future and if you preserve them. HIV associated nephropathy.
Collapse.
Classical question. Collapsing glomerulopathy is a classical feature with focal segmental glomerulosclerosis.
Meningococcal meningitis.
So today's NIMSET paper definitely glomerulonephritis. I am waiting which question they will give. So if they give the paper out tomorrow evening, please don't forget, you can call your friends also to come. We will have an academic feast of summer. So in October, November, December, life is glorious with hundreds of you attending the class on Sundays. Slowly we are bidding a farewell to you. Another 2 weeks you must join the post graduation. So doctor, meningococcal meningitis is what need to be basically remembered.
Alkaline phosphatase.
Eosinophilic granules,
Acid.
alkaline phosphatase. Actually this was given Trendelenburg positivity.
Extensors will not be this. Weakness.
It is not for the extensors. Hip abductors dislocation, any loss of that fulcrum will be responsible for the Trendelenburg positivity is what you have to basically remember. Pawn ball megakaryocytes.
Myelodysplastic.
Classically they are a feature of dysplasia where there is a discrete nuclear lobes with multinucleation called pawn ball megakaryocyte is a feature of myelodysplasia. Actually this was the scheme given, remember doctor, spermatogenesis के बारे में सीमेन क्वालिटी WHO स्टैंडर्ड्स के बारे में जरूर एक क्वेश्चन आएगा. That's a favorite area for the examiner. So primordial germ cell is diploid, spermatogonia are diploid, primary spermatocyte is also diploid. When it becomes a secondary spermatocyte, then it will become haploid is what need to be remembered. Will Felix heterophile agglutination test. Actually this was the barium swallow radiograph which was given in the original exam. So it is the squamous cell carcinoma which typically leads to the tailing towards the terminal part. So a good number of students are going to take the mock test tomorrow. We will try to give that image printout of all the missed images in the question paper.
IgM.
2-mercaptoethanol.
IgM.
It is the IgM. Very difficult to guess.
Recent SVM.
Huh?
Re,
Swims exams, and that's what. एक क्वेश्चन तो इम्यूनोग्लोबुलिन्स के बारे में आएगा. That is the rule in the high yield topic list. When there are so many beautiful questions, examiner picking up mercaptoethanol destroying which immunoglobulin is most, unless you are doing microbiology laboratory technician course. This question from where it comes I wonder, but anyway. Actually this was the pedigree that was given in the NIMS exam. Every time if the disease comes only if the mother is affected but not when father is affected, think of mitochondrial inheritance. All trematodes are monoecious but which is dioecious?
Schistosome.
Wow, that is there is a male female, Mr. and Mrs. is available in Schistosoma japonicum, dioecious, sexually dimorphic, then no second intermediate host, live in the blood vascular system, etc., etc. are the features. Radiolucent defect except
Calcium oxalate.
calcium oxalate, which is typically radio visible. So this is a typical picture where you can see in a plain film radiograph of calcium oxalate stone in the lower pole of the right kidney. This is another show of the calculus in the right kidney is what you need to. This is an example of what is this called? Staghorn calculus. Where do you find?
Phosphate protease.
Proteus mirabilis infection. Then this is a radio opaque cystine calculus. Generally uric acid calculus is radiolucent.
Optogen sensitivity.
So doctor, what is the rule? 3 types of tests: optogene, bacitracine, novobiocin. Optogene to differentiate Streptococcus pneumoniae from the other alpha hemolytic streptococci. Bacitracine is for B for beta hemolytic streptococci from Streptococcus pyogenes to differentiate bacitracin, B for bacitracin. Optogene is P for pneumonia. Then novobiocin to differentiate Staphylococcus epidermidis from the other coagulase negative streptococci, the staphylococci which include Staphylococcus saprophyticus. Ekdam you must be sure when you go to exam, doctor. How do you differentiate the various cocci from one another is a favorite question. Lamina propria mononuclear cells. Immunoglobulin A positive plasma cells are most populous cells in the lamina propria which are offering us the protection. 70 years, very good. Bacterial ribosomes have a sedimentation coefficient of 70 years. Actually, except hiatal hernia, in all the other locations they undergo obstruction is what you need to remember. Streptomycin and ethacranic acid combinedly can lead to development of oto or reno? Ototoxicity. Biliary coli, if you are suspecting somebody who has got a abdominal pain, what is the best initial investigation? Ultrasound abdomen, nothing can beat. It is 95% sensitive for gallstones larger than 2 mm and 95% specific for gallstones that produce acoustic shadowing. Sulfasalazine, inflammatory bowel disease. Most abundant, immunoglobulin A. Teicoplanin is a glycopeptide antibiotic.
Polymyxin and colistin
Polymyxin?
Polymyxin B and colistin are also others.
Excellent. Then which are oncogenes except?
P53, tumor suppressor.
P53 is not an oncogene but it will prevent oncogenesis, is what need to be quite sure about. Without anticholinergic action, what was your honest wrong answer?
Cyproheptadine.
You thought cyproheptadine. Mesolastin, beautiful. Non-sedating antihistamine, it blocks H1 receptors. It does not actually prevent the release of histamine, but it will prevent the binding of the histamine to its receptor, is what you have to basically remember. Obesity के लिए what is suggested, doc?
Orlistat, lipase and
Orlistat and sibutramine are the ones which are the two agents approved for the treatment of the obesity, is what you have to basically remember. Then Mallory-Weiss syndrome, what happens?
partial tear against closed.
Basically that can lead to upper GI bleeding, which can be quite severe.